So I'm going to talk a little bit about glaucoma and what glaucoma is. Glaucoma is a disease of the eye that damages the optic nerve at the entry point of the optic nerve into the back of the eye. The early symptoms of this usually are unknown to patients because you lose your peripheral visual field, and for most patients it's a very slowly progressive disorder. And so the only way we can really find the early signs of it are by complete eye exams, which are why we have patients come in on yearly exams. Particularly the older a patient gets, the more risk of glaucoma there is. So we have patients start to come in more frequently as they get older. A lot of the testing that we do for glaucoma, the biggest, most important test is actually the eye exam that we do ourselves and visualizing the optic nerve and the changes over time. But we have other things that can help us out, such as an OCT, which is basically a picture that shows us how thin or how thick the nerve is. A visual field, where you get to sit behind a little half dome and click a button with bright flashing lights, and that shows us very early signs of when there may be visual field deficits, as well as other subtle testing such as pressure and things like that. Other risk factors that we found with glaucoma are age, family history, corneal thickness, so we do take the thickness of the cornea when we're concerned about that, and other factors such as high blood pressure, diabetes, and smoking, as other, as some of our other videos may have shown with macular degeneration. So if we do develop glaucoma, generally as long as we find it early, treatment nowadays with medication or with lasers is very effective, and rarely do we have to proceed on to surgery, but those options are available as backup if we need them. And so as long as patients are coming in for their yearly exams and we're observing the optic nerve appropriately, a lot of times this disease, we can decrease the progression significantly and help patients see long into their lifetimes.